Good afternoon and welcome to BuzzlocalTV. This afternoon, we're very pleased to have Kat Lanteigne from Toronto. Hi, Kat. How are you?
Hi. I'm good. Tired, but good.
Yes, you had a long tour. You said you're the executive director of BloodWatch.org, correct?
Yes.
So maybe first tell us a little bit about your organization.
Our organization is made up of tainted blood survivors, safe blood advocates, citizens, and also patients who use blood and plasma-based medications. We were founded because our group, the core team of our group, were the advocates who made sure that this private for-profit blood broker was banned from Ontario, and we petitioned the government to get a law passed banning them. And so we formed this organization. In the early stages, it was just meant to educate people about the Crever Inquiry and about the tainted blood crisis, which is our country's worst health crisis. It infected over 30,000 Canadians with hepatitis C and HIV, and has killed up to 8,000 people in our country. So it was a very serious piece of our Canadian history, very sad, very tragic. And the piece of the scandal that people don't understand is that it was preventable. So there's a false narrative out there that the tainted blood crisis happened because of bad science and poor testing, but that's actually not why so many people were infected. It happened because the governments and Health Canada and the Red Cross did not protect the blood supply, and they did not inform people that they were exposed, and when they had tests, they didn't implement them. In our country, every single vial of tainted blood went out. Every single one, knowingly. They knew it was infected, and they still sent it out, all just to save money.
Wow.
And out of that came the Crever Inquiry, which was a 4-year federally funded royal commission, which investigated why and how that happened. And out of that came a fundamental report that is now used around the world as a pinnacle document to operate public health systems, including ours, not just blood, but other health systems. And we have been following those now since 1997, when Justice Crever issued his report, and the existence of a private blood broker would undermine the report in its entirety.
Wow. We were talking to the CEO of the organization that wants to set up the plasma collection center here in Moncton. And he was saying that the Canada Blood Services has no issue with what he's doing.
So that's completely false, and you can see the CBC article that was run 2 days ago in New Brunswick. Carissa Donkin was the reporter, and Dr. Scher, who is the CEO of Canadian Blood Services, has come out against the clinics. He doesn't want them here. He didn't want them here in Ontario. He said as much with us. He testified in support of the legislation here, and he just made it public that he is very concerned, as we are, where Minister Boudreau thinks that plasma is going, because Canadian Blood Services will not buy it. The other thing that people in New Brunswick and in Canada need to understand is, if Canadian Blood Services, as the only buyer, right, of plasma-based medications, is not going to buy from that company, where is that plasma going? Right. This is a very serious situation. The plasma that's being collected by this company in Saskatchewan can't go anywhere. It can't leave the country to get to be processed because they don't have a buyer here. So that plasma that should be being collected by Canadian Blood Services so we can use it, right, for Canadian people and Canadian patients, is now getting wasted. It's absolutely outrageous. One of the biggest reasons why it's so important that all the provinces have a pan-Canadian approach to blood and blood collection and management is because we're a national system, so we share it, right? So if one province is low, another province will, Canadian Blood Services will give from another province. And we can't have any incongruity in that system, especially if we have a national emergency. And it's very important for us to mobilize donors and take care of the donors. So the difficulty is now we have a private blood broker run amok in our country, and nobody wants to deal with them because, it's just too difficult. And I think what they're trying to do is just hoping that they'll fail, business-wise, and pack up shop and leave because it's become such a headache. But in terms of public health policy, I am absolutely gobsmacked that Minister Boudreau would abdicate his responsibilities as a provincial health minister because he has total jurisdiction. Health Canada was granting that company a license here, and our health minister stood up and said, absolutely not in my province. I mean, I was shocked. This is New Brunswick. I'm a girl from Bathurst. My family's up in the North Shore in Caracat. And all the people that I have met so far, I've had 2 trips to New Brunswick. I haven't had one single person say that they think this is a good idea. Right. They don't support exploiting vulnerable and poor population. And I take total exception to the fact that, your young premier would think that it's a good idea to allow a private company that could possibly exploit the most vulnerable people in your population, undermine our blood system for a handful of jobs. Right.
But is it, sorry, and this is way beyond my understanding, but if they say that 75% of plasma has to be bought by other countries anyway, from Europe or from the U.S., if the quality can be assured, what difference would it make?
So just to clarify, we don't buy plasma from other countries. We buy medication that uses plasma as a derivative in it.
Okay.
So that goes through and it also goes through a tendering process, and it's a competitive market depending what that medication is, what patients need it, how much we need it, and it's a very, very, complicated process. It's also a, big business in terms of what we buy from pharmaceutical companies.
Right.
With this company, they will export our Canadian plasma, and once it leaves those borders, we have no jurisdiction over it. So it doesn't matter how regulated the industry is. The fact of the matter is that in our country, the right for us to use voluntary donated plasma that is collected by Canadian Blood Services, who has direct responsibility to the Canadian public health, has come at an incredible cost. So there's no purpose for a blood broker. It's a failed business. Why would we buy our own blood back?
Right.
It's crazy. Canadian Blood Services already gets it for us. So this narrative that's being created, that because Canadian Blood Services stopped doing their job and they stopped collecting enough plasma for us, so we were buying too much foreign, human tissue on the world, is a total false narrative. Because if the source is Canadian veins, it's up to Canadian Blood Services to do it. We don't need a private blood broker to step in to fulfill their role. They're not here to make us life-saving medications. They're only here because they found a loophole in our law to find a way to make a profit off of our blood. I mean, Minister Boudreau really pressed me on that issue because he kept asking me, well, why is it okay for them to pay people in the United States? And from our organizational point of view, we say it's not. I mean, but we don't have control over health policy in America.
Right.
But we do here. And Minister Boudreau and the federal Liberal government have not consulted with anybody. The Saskatchewan government didn't consult with anybody. The public didn't know. The nurses didn't know. The doctors didn't know. And the patient groups didn't know. And if you go to BloodWatch.org and you see the list of opposition that's growing, I can't keep up with posting, the letters that are coming at us across the country and organizations that don't want this. It is confounding to us why any of these publicly funded institutions that are supposed to be making decisions on the for the best interest of the public are supporting this failed business model. Because it's failed, because Canadian Plasma Resources simply doesn't have a buyer. And there's absolutely no way any health minister in this country can justify our plasma being shipped out of the country for sale on the world market when we need it to live.
Well, they were saying yesterday that the only market they can sell it to is Canada. So they're not going to sell it to anybody else because Canada is the only market. So
right, they're saying their Health Canada license was changed before they were gonna let them export it, and then in Ontario they realized that was such a train wreck that now they're that fell flat, and so their new license apparently, now I don't know if that's true, right? We're just taking that from what the company's saying.
Sure.
But if it's true, They don't have a buyer now. Canadian Blood Services will never buy from that company because we don't have to, because they will collect for us. And they take care of the donor. They know that they have access to all the donor files through Canadian Blood Services, so they can do proper tracebacks, right? If any of that plasma is being donated is infected. And then they oversee that medication. They ship it to a vetted fractionator in the US. That facility gets cleaned, and our plasma gets put in, and the medication gets made, and then it's brought back. So we commission a fractionator to do the final process on our behalf.
But couldn't that be the same with that company, using that exact same processing company in the U.S. and have it sent back?
We have no oversight, is what I'm saying. Once that plasma leaves the borders, there's no oversight.
Okay.
The other thing is, why are we creating a profitable system off of something that should never be profitable? We're not supposed to make a profit off of human tissue.
Right.
And that is these are fundamentals in Justice Creever's inquiry. Not only that, but recommendation number 10 was that that no duties of the national blood operator should be subcontracted out to others, because it fractures the system. So Canadian Blood Services has no ability to have any oversight into that facility, right, at all, or their donors. Health Canada just regulates the actual facility itself, and then that's it. And all of these things that are being set up are exactly the same model at the beginning of the tainted blood crisis, which is what we keep saying. It was this idea that you wanted to make a profit out of the blood, that blood and plasma were so lucrative that maybe the government should start, getting a piece of the action. And so it's privatization and deregulation at the same time. And now everybody keeps talking about how regulated this industry is, right? And here we are. We've got a private blood broker run amok. There's not a health minister in the country who knows where that plasma is going. Not one. And if you call Jane Philpott's office, they will not be able to tell you. So they don't have a buyer. They're collecting plasma from people in Saskatchewan right now that is sitting in a freezer that we can't use. It's the summer months, so Canadian Blood Services is straining because this time of year is always hardest, for them to pull in donors. How is that responsible, and how is that democratic, and how is that safe? When we argue safety, we're not arguing the end product. That's not what we're arguing right now. We're arguing the point of collection and the fact that in our country, we have a public voluntary system, and there's no reason, justifiable reason to anybody to privatize it. So all of these public funds have been used, and the mechanisms of our federal government have been used by Big Pharma, essentially, because we've been on the ground fighting this for 5 years, to privatize a huge part of our public health system.
Sorry, I mean that's kind of it's been a long debate now, right? I mean, privatizing healthcare services, and if Blood Canada, Canadian Blood Services can't make up the shortfall.
So that's completely false.
No,
that's not. None of that is true. They stopped collecting. So they stopped collecting enough. Well, first of all, there was a time where they didn't have to because there wasn't a demand for the drugs. Okay. So to be fair to Canadian Blood Services, there are new drugs available that require the plasma, and so they make it and they use it to treat cancer, and they make medication for hemophiliacs, and they make IVIGs and people with asthma. It's for many different uses it has. But the shortfall can be made up by Canadian Blood Services because they haven't been collecting. So they're launching a program later this year to double or triple our collection facilities. There's no collection facility in this country in any urban center for plasma or on any university campus. And so we don't want a competitor. That's what I guess we're trying to explain. A facility like Canadian Plasma Resources is actually a competitor for our system. Okay. And so it creates this competition and this two-tiered fractured system. There's nothing that we want about the American blood system in our country. The WHO wants this to end by 2020, and there's only 3 other countries in the world that allow it, including Germany. And Germany has been the implications of allowing a private collector are rearing their ugly heads there. because they're stealing away the young donors who are getting so cultured that they're owed money, right, to donate.
Right. Mm-hmm.
So they won't go to the German Red Cross and donate for free. One of the main reasons why the organizations refuse to pay for whole blood and plasma for transfusions is because it's a fact that when you pay people, the infection rates are higher, because people often lie because they're going there because they're desperate for their money, right? They're not, the mentality isn't that they're going there to save a life.
Right.
So all of these things are safety issues, and mobilizing your donor base is incredibly important. Now, Germany has 85 million people, and they're having troubles, and we only have 35 million people in this country, and we're geographically, 10 times the size or whatever we are. Mm-hmm. We can't afford it here. It proves that it doesn't work. I don't care what America, does. I mean, we do, because we don't support their practices. The poor and the vulnerable in that country are literally being farmed for their plasma. Flint, Michigan, Youngstown, Ohio, Atlanta, people lining up around the block, and you can easily Google it, and there's some articles on our website, because they're so desperate for their money, they don't even have enough money for food. So there's other cultural implications and safety implications that we speak to from an organizational point of view that none of the health ministers except ours here in Ontario, and the health minister in Alberta has taken very seriously, are looking at or considering. It is such a sign of government and wealth for people who are sitting in power like that to think that it's okay to deregulate and allow a private company like that to come in and exploit people. I mean, it's just, there's nothing Canadian about this, and we won't stop until we win this fight. It's just not going to end. I am tired now, but I'm getting a little and come September, we will be back out on the road. And at some point, our Prime Minister is going to have to start answering some very serious questions. For real. Not, oh, it's regulated. Oh, it's fine. Oh, we buy these drugs from the States. Because that is not what we are arguing here. Okay. These other things that we've been discussing are much more important, and they have to do directly with the impact of our Canadian blood system and our Canadian citizens.
Fair enough. Well, that's certainly a lot to think about, and well, I'm very curious to follow up with you later on when you're got your second win and you're back at it in September to see what happens, because it's a big issue. So thank you very much for taking the time to explain it to us. There's a lot to consider, and I know you just got back, and thank you very much for your time. We'll talk again soon.
Okay, thanks so much.
Thanks. Bye now.